Croeso, welcome everyone. Welcome to this, which is one of our regular series of knowledge sharing webinars. Hopefully you can see the first slide, so you know you're at the right session on using data to make better decisions and make decisions. We are recording this session for those who signed up and haven't been able to come along, or for anybody else. I think we'll make it available up on our website. I think we publish them up there. And we also have, although we're not doing a live translation, Welsh English translation today, we do have the ability to take questions in Welsh or English later. We'll be able to do that. So thank you. So we have, as I say, this is one of our series of webinars where we today looking at using data to make better decisions, and we have three expert speakers, panelists with you. I'm looking at them and saying they're expert speakers, so brilliant, welcome. We have John Morris, Head of Data Unit in Welsh Government. We have Jeremy Griffith, who I've got down as CEO, Tech Trace Protect, on the COVID vaccine in Wales, the Wales NHS, or NHS Wales, so welcome to you. And lastly, Suzanne Draper, who's Head of Insight and Engagement at Data Cymru. And they're each going to give short presentations, a few slides and things, sharing their experience, giving some case studies and how we as public servants across the piece or wherever we are can make better use of data as we're delivering public services, and how we should, and with perhaps the skills, and perhaps we can then have conversations around that. We'll have a session after the presentations with Q&A, discussion, and open to everybody. So if you have questions, you can put them in the Q&A, or you can put them in the chat. We'll try and follow those through and bring people in for that discussion, but we'll do that after the presentations. So thank you very much. And I think our first speaker is John Morris, from Head of Data Unit in Welsh Government. So thank you, over to you, John.
Lovely, thank you, Simon. Good morning, everyone. Bore da pawb. So as Simon said, I'm responsible for what's called data and geography at Welsh Government. So my remit is things like open data, data standards, data ethics, data science, geography, data sharing, but also I'm working with our Chief Digital Officer, Glyn Jones, on our digital strategy and the delivery of the data and collaboration mission. I'm going to really talk to you today. I guess before I come to some examples of how to use data for decision making, I really want to focus a little bit around some basic principles to help us with that. Next slide, please. Awesome. So there's a really important point here, which is actually data shouldn't be difficult to understand. One of the challenges which we've got is actually when you're presenting data to people, can they understand it? You know, this isn't a skills thing. This is actually about how can analysts and others which you work with actually help you to understand the data better. And there are some terrible examples on the left hand side. I hate pie charts personally, but you can see, if you see that pie chart, it's a nightmare. You're not going to really be able to understand much from that. And then you've got some issues in the middle there with charts and axes. The really important point here about charts is actually, you know, starting at 0 can be really important. Otherwise, you're exaggerating the scale, which can really, you know, if you're looking at that top chart in the middle there, you might think, oh, that's a big jump. But actually, when you change the scale to 0, you see actually it's a 10% jump. It's not small, but actually it's nowhere near as accentuated when you start the chart at 0. And then there's my favorite chart of all time on the right hand side, which I think goes to show that charts can be nice and fun as well. Is it rabbit or is it a duck? And it depends which way you look at it. Next slide, please. And actually, you know, when you're putting data out there for people to use to make decisions, you really need to think about who's your audience. And actually, the pandemic's been a really good example of this. So these are screenshots of, I think, 7 different dashboards which contain data for Wales. And they probably all have a slightly different audience. Okay, it's a bit of a crowded space if you want to go and find data about the pandemic in Wales, but actually it's really important when we're doing and making data available for decision making, what's the audience going to be? You know, certainly, you know, if you're giving information out to, you know, ministers or senior officials, you probably want something which is pretty easy to get at very quickly. But actually, if you're working with, I don't know, your finance team and you want to be able to get some detailed finance reports, you can probably get some quite granular detail in there. It's really important to think about actually who you're targeting your kind of that decision making out, and who is that audience. Next slide, please. And actually, you need to ask questions about the data. Don't just take it on face value. I think it's really positive that people are willing to challenge data, and that's certainly been something which people have done the last 2 years. And this chart here is kind of quite a good example of that. So actually, if you look at it, the scale's a bit terrible. So it's got 2 scales, one for one series and one for the other. But actually, when you look at it, I think, well, actually, those two follow each other. They're probably related. One goes down, the other one does as well, and when it goes up, so does the other one. They must be related. So that's great. Well, if we focus on one of those, we can influence the other one. Actually, you need to think a little bit about that. So if we go next slide, please. What this actually is the relationship between the number of people who've drowned by falling into a pool in America, and actually there is a relationship there with the number of films Nicolas Cage has appeared in. Clearly, the two things are totally unrelated, but they just happen to move in the same way. And that's why I would strongly encourage everybody, when you get data, ask questions about it. Where's this from? Should these things be related? Are they just actually coincidental? And why are we seeing those patterns in the data? Next slide, please. So talk a little bit around some of the work which we've done within Welsh Government, and Jeremy will probably talk more about this. But one of the things which we've been working on is obviously thinking about vaccination centres and when they're going to be over the course of the pandemic. And we were able to draw on expertise from Ordnance Survey to help us map drive times from vaccination centres and actually look at areas where the drive time was much longer than other parts. And this is a snapshot of Pembrokeshire. Some of you might recognise Haverfordwest on there and Milford Haven. And you can see where the red is, actually those drive times are very short, and that tends to be around built up areas. And actually, if you go to kind of sort of very rural Pembrokeshire, so over towards Marlows there in Dale, actually those drive times are much, much longer. And actually, this is a very visual way to present that data, and it makes it really easy to understand. You couldn't do this with a chart or with a table. So it's really important that you think about how you kind of deliver that information to help people to be able to make effective decisions. Next slide, please. One of the other things which Welsh Government has been doing is trying to promote the use as part of, through our Smart Town initiative, is trying to use sensors actually to allow towns to be able to see when people are going to visit towns, how long they're there for, and actually particular hotspots. So this is Porthmadog up in North Wales. So you can see that in the top right-hand chart, and there are hotspots there around where the sensor points are, where there was more activity detected. And at the bottom right there, you've got a chart of number of visitors over time. And what this allows those towns to do is be able to see actually when are people coming, how long are they staying for? Why aren't they staying for as long as we think they might want to? Are they focused around one particular part of town? This allows them to look at new insights and bring people into the town. Is parking an issue, for example? Is there issue in accessing certain parts of the town because of traffic congestion? Do we need to enhance public transport within the area or active travel? And data like this, using these sort of LoRaWAN sensors, can be really powerful to help those towns actually look at it and understand how they can bring more people in. Next slide, please. And my last example is around something else which we've done around mapping. So actually, data doesn't have to be complicated. It doesn't have to be really difficult and sort of using data science to actually be able to use it to its full potential. Colleagues in our emergency mapping and resilience team it dropped out then. So this tool, Jigsaw, has been developed to help to respond to an emergency situation. So this is where the resilience community and emergency services in Wales can rapidly get access to information about vulnerable individuals. And what this means is, before, it would take around 8 hours to get key intelligence out to resilience partners to identify vulnerable households. That now takes 3 minutes with Jigsaw. And actually, it's not a really difficult thing. What we had to do is come up with a technical solution, but all we're doing is sharing property locations. And that goes to show that actually data isn't just about doing whizzy things. Sometimes it's about getting the basics right and making that data available to the people who need it rapidly. I will conclude there. Thank you.
Thanks very much. I think we'll just move straight on to Jeremy, if we can.
Thanks for that. Sorry, trying to convert from Teams to Zoom. It's obviously beyond me. Can everyone hear me? Yeah?
Yeah, we got you.
Okay, good. Okay. Yeah, thanks for that. So I'm going to sort of manage some expectations here. So I think the first thing to say is that I'm not a data scientist, data analyst. Managed to scrape a GCSE C grade in maths on second attempt. So, but data is very important to me, and hopefully the next slides will show that. And even the fact saying next slide, please, it become common parlance in the last sort of 2 years, as John just mentioned. So, yeah, it's really important for me. I've come from a clinical background. When people turned up to see me, we didn't sort of say, well, you look a bit sick. We take a lot of information, gather data, take some tests, and it's very important to formulate the plan. So it's data is a very key component in the work I do, and it's always great to become big friends with data experts and data scientists. I'll take you through sort of my COVID-19, so my not BC, not before COVID, my COVID experience. I was director of operations at what became known as the Dragon's Heart Hospital, and that was the Principality Stadium, looking in its all finery there, ready for a stadium, and we had 1,500 beds for patients there. Quite a scary thing, really. I think one of the most important things there where data helped me was, it was built in 10 days, and there was a phenomenal amount of data. I'll never forget one of the joiners saying, that you always measure twice before you cut once. So, it's very important you do challenge the data and on everything you do. But we used it in a very critical point. So we knew we were going to get in the hundreds of admissions every day according to the modelling and the first wave. And with 1,500 beds there, how quickly can you fill them? So that goes down to, bringing all the intelligence we had around us, really. And that came down to the WRU, who knew how many lifts and which floors they went to. And we used all 6 floors of the Millennium Principality Stadium. But we also needed to gather data on, with all the constraints we had of 6 lifts. It was the porters there were doing 20 to 40,000 steps a day. So there's always the staff well-being. It became critical then to check with the time series about how we can fill the beds in order for it to have benefit. And so what we did there was we worked through gathering the data. We're quite a small team looking at that. Some really brilliant people who were able to sort of model it through for us. And then we would make some changes and come up with a plan where we could admit up to 800 patients a day with all the constraints we had, and then work the workforce model back from there. And then we were able to scenario that then in terms of looking at that time series, and then base it on facts about what would be the best, solution for 20 patients coming in a day, and and it was allowed us to make risk-based assessments on the scenarios we put in front of us. And I think that when it came then to when we started having patients there, it gave us confidence that what has never been done before, certainly I'd never been involved in something like this before, that we were trying to do the most safest transfers, the best transfers, but also trying to meet the challenge of how we could utilize the facility for what it was meant to be, an emergency response to quite scary times. Next slide, please. So I came out of the stadium about 4 days of when we sort of started decommissioning the stadium, and then I got a phone call to look at test, trace, protect. And in all honesty, I didn't even know what it was because I'd been stuck in the bowels of the Principality Stadium. But essentially, test, trace, protect was my role in that was, okay, so how can we make things faster? Getting your test fast is important. Being contact traced fast is important. We were building something from quite good setup in terms of what the testing and tracing had been set up before, but this was on a different scale, testing more numbers we've ever tested on any type of tests, and then contact tracing, which was like a brand new service really in terms of the scale of it. The published when you see number of tests authorised by Public Health Wales, and that's what you see published. You can access that, but there's a lot of operational information we had to get together, and my team in the NHS Wales delivery unit of analysts had to really get into the back end of some systems to get some information that was really important for a number of reasons, really. So we needed to know where the sort of constraints were of tests. What was the delay process? So was it in the test happening? Was it in the booking system? Was it in the laboratory? Was it in getting the text message saying you're positive or negative? We needed that broken down at a granular level. And then we need to know at times of day, and we need to know at different sites and accessibility. So there's a lot of information that was required. And very quickly, I started there in June, and by about the August, we'd put, working very closely with Public Health Wales, put a case together for one of the most significant investments in microbiology, which Wales has done. And we also then brought into, were involved with a national testing system with UK Government and Scottish Government and Northern Ireland Government. And we sort of were able to describe and articulate the ask for Wales and what the population of Wales would need. And that was because everything published, we needed operational data that was live. Now, we don't publish that because for all the reasons it needs to be checked and questioned, but we keep an eye on that every day now, and it becomes our first thing we look at. We get the data drives every single decision we make, and then we get the feedback from a local and national level. And where that's really important is it sort of links into where we need to go next on things in terms of advising on sort of strategy and policy for government and for ministers to make decisions on. So we look at the age test. So how do we test more in school children around that sort of September time and ongoing, and things like that, care home testing and things like that. So it's been very, very important data. There's only a small team of us in NHS Wales national team. There's about sort of 4 or 5 of us, but all with that sort of none of them data analysts. We've got a team which separately looks at that, but all have got the ability to question, interrogate, and some of that sort of basic data skills really to use the information to support the decision making. And then I'll go on to the next slide, please. So vaccination. So so about December 2020, yeah. I got asked to look at get involved in the vaccination programme. Again, information has been very important to me before COVID and during COVID, as I've mentioned, and important in everyday life. You know, I rely on the car telling me when it runs out of petrol, because that's important. You know, go on your banking app and you see those pie charts and that spend analysis. So it's part of every day, and even so more in my professional life. And this is where it's very important as well, because the information we were capturing on vaccines was vast. And there was also, by this point in time, when the vaccination programme came along, that hunger, that thirst for information, because, you know, we've seen it once, twice a day on the BBC News. People have become experts in seeing that and asking questions like they never have before. So it was very keen that both we understood internally, but to publish externally what the information was telling us on vaccine. There was an incredible amount of interest in it, as you can imagine, with the restrictions we'd all faced, and decisions had to be made on that. So we had a lot of data, but what we needed to know was not only the impact of the vaccination, which was quite articulated from a clinical perspective, but how were we going fast enough? Were our freezers empty? And also, were we going in the order prescribed by the clinical advisory body, JCVI? And were we being proportionate? So was there equity of vaccine delivery? So a very fast-paced programme that relied really on checking in on the data, and I mean on delivery, probably on an hourly basis between sort of January 2021 and June 2021. It was on an hourly basis between the hours of sort of 7 and 10 o'clock at night when vaccine centres closed, because you wanted to know what the closing day position was, beginning of the day, because there could be a time lag, and actually where we were going throughout that day, and then where was some sort of intervention required or some support required, and what was going on. It was that sort of laser focused. I think where it got to then, where I think the most critical point of where the information we had was important, was when government and minister and the First Minister needed to make decisions. So we were at a level 4 in order to get to level 0, the advice we're getting clinically, we need a certain level of uptake. Where do you think we're going to be in the next 2 weeks, Jeremy? Where do you think we're going to be in the next month on first doses and second doses? And then it just brings into focus then not just the having the information, the understanding of the information, but putting that together with what we know delivery looks like, and that sort of emotional intelligence as well about how the system delivers, broken down at health board level, allows you to sort of put your neck on the line and put a projection in that you know is going to be critical for helping ministers make a decision on moving alert levels. So again, that was very important. And then the last point, the Omicron variant plan, what that was a meeting on a Friday. I got to hear about it on the meetings went on at the UK level on the Saturday with the chief medical officers and government officials. And then on Sunday it was, look, we've got to offer everyone a vaccine who's eligible at 3 months as quickly as possible. And by the 31st of December was the UK sort of target. So we had one day to plan for 1 million vaccines over 14 days, essentially. And the first place we went to was, can we do it, yes or no? And the first thing we did on that Sunday was a very simple table about the size of the challenge and what we would need to do. So we went to data first. And going to the data first allowed us to bring what was quite a hectic period into quite a calm period. It allowed us to methodically go through what we could do and make a call on what would be needed in order to deliver this emergency response at the pace required. So it just sort of settled everything down with the objectivity and allowed us to make decisions on fact rather than sort of the emotion going around at the time. And then 2 quick slides next. So the next slide is, Clive Humby said, data is the new oil. It's very important. We use it in everyday life. And as a currency now, people always look at the facts. Next slide, please. But like oil as well, can be very corrupt. So John is right, question it, check it. And if you're not an expert in this like me, then get some basic skills in it. It's not scary. We're using it all the time anyway. So get some basic skills to ask questions, to understand. And then next slide, please. Last slide. The thing I'd finish on really is, and I think there's a few, you can click through all the boxes, I think. I don't know what I'm doing next. Vaccine is getting to a stage now where we've gone from doing 65, 70,000 a day before Christmas to about 4,000 or 5,000 a day for a whole host of reasons. We vaccinated a heck of a lot of people. There's not many left, but also there's, there's the infectivity period of Omicron means that, there's a lot of people who aren't eligible for a vaccine. They'll come on eligibility. So I don't know where I go next. But what I do know is that whatever I do, wherever I'm going next and whatever challenge or problem I've got, it's going to be going through this system. I've used this in a number of places now. So make sure we all got one set of data, create quite a small team to have a look at it, understand it, and people own the certain parts and they own that and understand and able to describe it. And then we start setting them, well, where do we want to get to? Make sure we've got some accountability, make sure that it's consistent and accurate. Make sure there's integrity in the data, that actually where it comes from, what it means. And it may not be perfect, but sometimes to progress, you don't need it to be perfect, but you're always trying to make it more accurate. And then that allows us then to get that objectivity to come in and say, right, how do we make sure then that we've got, we know what the strategic goal is? Is it based on evidence? Is it doable? Can people see it? Do people understand it? And are we sending it out all the time? And that allows the system then, once the data's been sorted and once we understand all that, where we can get what we call in the NHS ward to board. So where it's happening operationally, it can be, at a bronze sort of level in emergency planning, right up to gold level, that it's got that sort of connection, that what's going on at the operational end is being understood throughout the system. And that just allows then for the data just becomes part then of that intelligence system that allows you to make decisions as required, to look forward a bit more. And then eventually what you want is that sustained and adaptive process where the data's got you to such a point and you understand it that it's, it allows you to just look so far forward and plan so far. And I think we're getting that on vaccine now. We're able to get to vaccine now, saying, well, we need to know the answers for these 6 things. If we know the answer to those 6 things, we can probably plan for the next sort of 12 to 18 months, where we've been planning in the next sort of like 6 to 8 weeks. That's it from me.
Thank you very much. So straight on, and we'll come to some questions. If anybody's starting to think of questions from this, you can put them in the chat or Q&A, as they say. But we'll move on now to our final speaker, and that's Suzanne. Thank you.
Thank you very much. And thanks to both the other speakers. I find it really fascinating to hear you both speak. So I'm Suzanne Draper. I'm Head of Insight and Engagement at Data Cymru, which is a reasonably fancy title, but essentially means that I spend a lot of my time engaging with and working with the sector to try and understand what's needed to help organisations become more data-driven, and crucially how Data Cymru can help with that. So if I can go to the next slide, please. Before I go on to speak about the work we do to support and build skills, and that's what I'm going to talk a bit about here, as both John and Jeremy have alluded to, the need for certain skills. I suspect the Data Cymru is not as well known as Welsh Government and NHS, so I thought I'd throw this little slide in just to kind of explain who we are. So not-for-profit organisation, wholly owned by local government, and a lot of our work is aimed at working with local authorities in Wales, but across the wider public sector as well. And as the name might suggest, Data Cymru, we offer a range of help, advice, support around data, stats and research, and there's a list of the type of work we can get involved with there. What you'll notice in a lot of these bullets is reference to help or advice or support, and that is intentional. It's not that we don't do any kind of direct work ourselves, because we do, but quite often we don't want to. Part of our remit from the very beginning, from our very inception, was around doing with, not for. And that comes back to this notion of building skills, of empowering individuals so that organisations then can do more, can do better with data. And that remains the case this day, possibly now more so than ever. We've heard about kind of the COVID work that went on with data, but the other thing, the other positive, if I can say that, from COVID was the increased appetite for data, the increased concentration and awareness of data. And what we now want to do is help local authorities and other organisations be able to maximise that and respond and keep that interest going, because it's fantastic. So next slide, please. So as I say, I'm going to talk about a few of the pieces of work, a few of the projects that we do in order to help build skills and capacity around data. First thing I want to talk about is Database at Cymru. So it's Database at Cymru is a training programme, and it's designed to help people get more confident with data. And that's a really, really important thing for me. I'm sure we've all seen and experienced how a lack of confidence or fear can really inhibit your ability to try or to do things, more so than your actual ability or capacity to learn ever will. So what this course does is build skills gradually as you move through the programme. It starts off at a very basic introductory level and introduces new techniques as your skills, knowledge and confidence ultimately builds. And I think for me it's interesting, it comes back to something Jeremy said in passing. I think it was that we all use data in our everyday lives, but so often people think that they don't. People's lack of confidence means that they think that they can't do data, or it's somebody else's job, and yet we do use it in our everyday lives. I mean, for anyone who puts the snooze on their alarm clock in the morning, that's a data-driven decision. You've decided that you've got time in your morning to hit the snooze button, and you can still get up and get to work on time. That's a data-driven decision. We do it without knowing. It's just that either we don't know or we don't realise, and so building that confidence, building that understanding is really where Database at Cymru is looking at. And it does that by focusing on the fundamentals there. And this comes back to both what John and Jeremy have talked about, the different types of way in which you can understand, engage with data. So it really focuses on the fundamentals. You need no prior knowledge of data. You don't need to be any kind of expert. You don't necessarily even need to be currently working with data in order to get something from the course. That said, I've run through the course obviously a couple of times myself, both as facilitator and attendee, and despite being someone that works quite closely with data on a daily basis, I still got something out of it. So whilst you don't need to have any experience, if you are more data savvy, you'll still get something out of it, be that it just reinforces what you already know. Or what I really found was that it reminded me of different ways of doing things. So, you know, of course we can analyze data, of course we can do X, Y, and Z, but we tend to do the same things in the same ways. And so the course really reminded you that there are different ways to think about these things. So really, really open to everyone, no matter how senior you are, no matter what your role is, everybody will learn something from it. So the courses are fun and accessible. I know that sounds maybe a little bit daft, but they really are. It's not spreadsheet training. It's most of the workshops, so there's a series of workshops, most of the workshops are focused on like the use of pen and paper and discussion. It's not a technical course in any way whatsoever. It's made up of a series of workshops and all last about 20 to 45 minutes each, so it's quite short and snappy as well. Really tries to make you understand, help you understand that the barriers that you perceive are probably not barriers actually, and that, you know, you can do this and we can do it in easy ways. I've put made in Wales, and it would be remiss of me if I did not mention that Data Basic as a training program was actually developed by MIT in America. And so over the last year, we've been working with both MIT and colleagues in Data Orchard to, for want of a better phrase, Welshify the course. So the Data Basic course, Data Basic Cymru, is now fully bilingual and all the content is Welsh relevant. So how would you go about accessing it, I suppose, is the key question. So Data Basic Cymru is an online website. You can go to the website right now. It's free, it's online. All the content is written in a way in which you can work through the workshops yourselves. You don't need anybody else to do it with you if that's how you choose to do it, either on your own or with a group of colleagues. Or you can choose to come through our facilitated route. So that's called Data Basic Cymru Plus. And essentially then you get a facilitator who will work with a group of colleagues and take you through the course yourself and be on hand to kind of offer that additional level of help and expertise. Whichever option you choose, the one thing I would advise is working through it with others, and that's not only because from an organizational perspective, having a lot of people hearing the same messages and learning how to become more data savvy will benefit the organization, but also as an individual. And again, this is one of the things that I learned as an individual. You'll learn how others engage and interpret data differently to you. So again, we're all kind of channeled to think how we think, and hearing how others might question data, as my colleagues have referred to, how others question data, or how others perceive a dissemination or something that's presented to them differently to you is really, really interesting, and will really give you that different perspective that you can then apply to how you might do your own work with data. I found that absolutely invaluable. And then obviously the slides will come out afterwards. That's the link to our website, Data Cymru's website, which will tell you a bit more about Data Basic Cymru generally, and then take you through to the website itself. And obviously there are contact details on that website should you need to get in contact with us and speak to us about the course. So I would really, really highly recommend it. Next slide, please. So then we also offer a range of other training courses. There's a list of them there. I call them more specialist training courses, and they're not really for specialists. It's just that they're more focused on specific aspects, as you can see. Presented data is an interesting one because it goes back to a lot of what John was talking about, particularly in one of the first couple of slides, about how do you make sure you're presenting data in a way that is not just accurate, but gets the point across that you're trying to make. And then we've got ones focused on surveys and focus groups. And as it says there, you know, we can work with you again to kind of work out how you would want to run that within your organisation. Up to 15 participants, and they last around 2.5 hours. We will have a web page on our website very soon, which will give you further information and allow you to sign up to the courses. But it's not quite there yet, so keep an eye out for that. Next slide, thank you. So the other thing that I wanted to mention was around a new webinar program that we have just launched. And it's got two strands to it, essentially. We've got our data to inform webinars and our data to inspire webinars. I guess the data to inform one is most relevant for what we're talking about today. So hour-long webinars. And our data to inform sessions are around, as it says there, introducing various topics related to data stats and research. Very high level, because it's an hour. You're not going to learn how to do all of these kind of things, but it's about, so we did one at the beginning of this month around an introduction to data science, for instance, and that's just, if you've heard of the word data science or you're fairly familiar with it and want to just know a little bit more, not so that you can go away and be a data scientist, obviously, but that you've got, again, that confidence that you could at least speak to somebody about what it means. That's what our data to inform webinars are aiming to get at. And then obviously our data to inspire ones are where we have the opportunity to showcase work that others or ourselves have done to kind of inspire others and to show what's possible, so that others can kind of get involved with data and use what we showcase. We've got a list there of the upcoming webinars that are already planned. So we've got one on Power BI, the Essentials, and that's happening this Thursday. And then at the beginning of February, we've got one around using data to understand poverty, and that's with the Joseph Rowntree Foundation. And then at the end of February, we've got another one of our data to inform webinars around citizen engagement, so the different ways in which you might be able to consult or engage with your citizens. Again, reference to our website where there is information about those webinars, and it will take you to Talking Cymru, which is where the ticketing website, essentially, where you can sign up to come along to any of our webinars. And the March sessions will be published shortly for those who are interested. And then hidden potential, last little bit, hidden potentially into the cameras is the word get involved, and that just means if you've got any requests for topics that we could use as the basis of data to inform webinar, please get in touch. And equally, if you're doing something with data and you think, well, actually this is something that I would quite like to showcase, again, get in touch, and we really are keen to work with people to host these webinars, to host your work and kind of get it out into the public domain more widely. Next slide, please. So this is the last piece of work that I wanted to talk about, and this is actually an initiative that we're working with with Welsh Government, and it's around creating a series of communities of practice around data, as you might expect. So, as I'm sure you can relate, there are obviously a lot of organisations across Wales who are all trying to do the same or similar things with data, and I think that's become more evident now since COVID than perhaps ever before. And we're all facing the same kind of issues and challenges, and probably have the same aspirations as well. So Welsh Government, with the Wales Data Leaders Network, came up with the idea that actually it would be really good to focus on some of these issues, these challenges, these aspirations that we might have around data, and bring people together so that we can learn from each other, to talk to each other, and potentially make some progress in some areas that we wouldn't be able to do individually as organisations. So we've got a list of the potential areas that we'll be focused on. We're certainly not going to take them all together at the start. We're going to prioritise them and work through them gradually over the next few years. And we're currently in the process of agreeing which of those might be the best ones to start with, and we're doing that with Wales Data Leaders Network. But we are also very keen for you to get involved, whether that's sitting on the Data Leaders Network, participating in one of the data communities, or even facilitating one. Very happy to hear to take volunteers or nominations. But crucially, it's all about us coming together and kind of learning and sharing together across Wales to help move this agenda forward. So the link at the bottom there is a link to a blog that we wrote recently in conjunction with Welsh Government. And in it, you'll see a series of questions that we're keen to hear from people around, and that is about, what areas should we focus on? Are there other areas that we should? Are there existing networks that we need to be aware of and link in with? And obviously calling for volunteers and calling for interested people to join in. If you are interested, please feel free to drop me a line. My contact details are in that blog as it happens. And we'll get the ball rolling, hopefully very soon. So that's me. There's one more slide, but it's just a closing slide and a shameless plug for some of our other work.
Thank you very much, everyone. I think we really saw throughout that there's some key takeaways from me. Some of the stuff about the making data accessible and understandable. I mean, I think Suzanne was showing that. I mean, Jeremy, the decisions that were being made from accessible and understandable data and the clarity you had to have that. And John's duck or rabbit, I think, brought that home. So we'll see if they've got any questions. There's no questions coming through, but please do feel free if you've got any questions. I don't know if we've got, otherwise we've got questions there. So nothing at the moment, but I suppose a couple of questions, or one area where we thought about and recognised there. Suzanne talked a lot about the training and the data skills and how, and I think Jeremy mentioned it, we've all probably become much more the armchair data scientist, particularly over the last 2 years now. We all look at the news every day. I know my partner very much. She'll call out every single data decision that's being made, and are we following the science or following the data? And so it's how much we have the confidence and what skills we do need. We don't need to necessarily be, more than the maths GCSE to actually make better use. So I don't know who wants to take a question here, but my question I'm leading up to is how much of a data expert we should be, or this is what we're trying to demonstrate here, is just as a public sector worker or wherever we're working, we can make use of data and understand it if it's become understandable and accessible.
I'm happy to jump in first. I would absolutely agree. And I think, much like the data basic course we were talking about, that very much aims on building, I say basic skills, I mean, it's not basic knowledge, but it is designed to allow everyone within an organisation to just have this confidence and this level of understanding. No, we don't need for everybody to be data scientists. We don't need everybody to have serious technical skills. There's places for that, but it's not what's needed. What we need is for people to have a bit of confidence about data so that they can understand how to engage with it, how to interact with it at a reasonably low level. And the key thing is so that people can start to have these conversations. As Jeremy was saying, he didn't necessarily come from a data background, but it's having the confidence to question the information that's put in front of you, to then be able to understand what it's telling you in order to be able to make the right decisions on it. So I think it is this notion, and it comes back to those fundamentals. It's about how do you understand what the different types of data are, and it sounds a bit basic, but I mean, we are talking as kind of low level as that in some ways. What are the different types of data? How would you question? What are the types of questions you might ask of it so that you can be confident that it is right and you do understand it? And then maybe how you can take some of it and really interrogate it to understand what it's telling you. And again, how you present it back to others in order to tell those messages. That's the kind of key focus that the data basic course follows.
Jeremy, did you want to add something on this?
Yeah, I think connections, partnerships, friendships, I think it all helps. I think that my sort of real experts, my real experts tell me is that data without them understanding the character of the problem or the task or the understanding why do I need it, what are you trying to achieve, is meaningless. Them trying to do it, they're almost data blind. They've got all the numbers, but what output are you trying to design? So you need to connect people, and we need to connect that sort of information from my perspective, from the operational end and the character of that and what it means, and then they can look at it and go, all right, you want it to look like this, or you're trying to assess that. And I think that's where you get the intelligence then, when we can sort of combine together, particularly from the NHS, when we put managerial, operational, financial, and then analytics together, we've been able to build something a lot more powerful rather than doing in isolation. And curious mind, for me, it's a curious mind. If you get a bill in a restaurant and it looks more than what you expect them to pay, you're going to question it. No different really than, but with the advanced part, I think you do need to get some support in there. But working together is the key thing.
Okay. John, just on one of the things you had on one of your slides was I saw it in the background, and it's this visualization of data as well in that point. And I go back to, was it Lloyd Warburton? I'll call him out. You had his slide. I mean, what was he, 15, 16? He was playing that data.
Yeah, absolutely. And that's been the challenge, isn't it, over the pandemic, is how do you make this information accessible to people? And this comes back to your, I suppose your question, Simon, is I think we need to do better at that. And this isn't just about people having the skills to understand it. This is also about analysts having the skills to understand who they're aiming things at. There's no point in me, giving reams and reams and pages of analysis to somebody who's only got 2 seconds to look at something. It's not going to help anybody. You need to be able to disseminate data in an effective way, and that's what people have been really good at doing over the pandemic, for good and for bad, I will add. Some people have obviously had vested interest in doing things inappropriately, but actually on the whole, lots of people have done some really good stuff. And I think that it's important that, as well as leaders challenging, how data is presented, so as analysts, we think about ways in which we work with people. This is kind of Jeremy and Suzanne's point around how do, come talk to us, analysts can help you, challenge us to make sure we're giving you ways to make those decisions easily. Let's not complicate it.
Okay, thanks. There's a question here. I didn't actually see if there is a question. I don't know if Gemma, are we able to bring somebody in to ask the question?
Matthew, one of my previous work colleagues, actually, has got a question for Suzanne. Matthew, if I allow you to talk, you can ask Suzanne directly.
Cheers, Gem. Thank you. Suzanne, really interesting to hear what you've got on offer in Data Cymru. I was just wanted to check on the costs. I'm from an Iron Bevan Health Board, and we've got quite a few things that we would like to talk to you about. Well, I have in terms of the work that I'm doing at the moment. I was just checking on the costs and what costs are involved.
Yeah, so the Database at Cymru facilitator session is around 3,500, I believe. There's about 11 workshops, and whilst they're only 20 to 45 minutes long each, so it's about a 2-day all-in kind of session with the facilitation and everything. The individual courses, the specialist courses, or the more specialist courses, are £500 each, I think. I should have had the figures on me, for the half day, 2.5 hours, half day type session.
Okay. Is the data basic intro, I had a feeling, was that originally being offered as free? Is it not free now, the very basic? So
the content is absolutely free. There's a website, you can go there and self-serve it and work through it on your own for absolutely no cost whatsoever. If you want the facilitated approach, where you work with a facilitator and kind of create the bespoke session and then have the facilitator come along and provide certain levels of support outside of the sessions as well, then that's what's paid for. But yeah, absolutely, go along and self-serve for absolute no money whatsoever, and it is written in a way that you can do that. It's not just, well, you can do it yourself. It's written so that you can walk yourself through it if you choose to.
And John, you've had I mean, I participate, I think I might be one of the first cohort to go through something that came out of, I think, the Welsh Data Leaders Network, or there was that program of activity that we can sign up to. So I think it's aimed at some senior leaders, senior managers as well, just to start getting from this understanding of how we should interpret and make better use of data in our decision making. There's that. I don't know how many times you're thinking of running that.
We run a data masterclass. We haven't. I can't profess to claim. I can't claim ownership of it, unfortunately, because it is a great course. It is really, really good. It was delivered. It was developed by Number 10, actually, in the data science campus, who currently run the data science campus too. So we're currently offering that out to senior leaders across the public sector. It's all about, I suppose, giving senior leaders insight into actually, into what they need to think about when they're looking at data. There's some great examples in there around, counting cows from space and fertility and other things in there, and some really bad things as well, which government have done with data. So, certainly if colleagues think they have, would be interested, please do get in touch.
Okay. Is a comment being made here on your Power BI webinar on Thursday sold out? I mean, Power BI is always one of these things that I think, oh, right, I need to be a data scientist. Look, it's meant to be a great tool, but it's always became a bit scary. I think people have been dipping their toe in the water and actually finding the what it can do.
Yeah.
Can you run it again? And have we got other ways we can run some of that?
I'm sure I can, absolutely. And if anybody gets in touch, as long as we haven't got too many numbers, we can add people on. It's just that it's on Thursday, so we've closed the actual ticket insight now. So do feel free to drop an email. I should say that the session on Thursday is more around if you're thinking of using Power BI, particularly from an organisational perspective, what are the things that you want to think about? So it's not necessarily how do you as a user open up the app and start using Power BI. It's much more about what are the things you need to think about in order to make sure that as you're doing it, you're doing it in the right way. We're going to be hopefully running one in March, which is more looking at the kind of art of the possible around Power BI, and that will be much more about what you put on the page and what are the potentials for that, and what might the inspiration and what might be able to learn from others who have done something similar. So if somebody is interested in coming along on Thursday, feel free to drop me an email and I'm sure we can have people on. And keep an eye out for other ones, because Power BI, as you say, it's one of those areas where people are really starting to kind of look at now, and any advice and guidance we can offer. So we will be inevitably running more sessions on that.
Okay. I think perhaps it was in your slide, Suzanne, on the data leaders network, but I know that there's some work that John, in fact, we at the centre have also got considering or got to think about how we can support. Data is one of the digital service standards that we've got for the digital service standards for Wales, making better use of data. And there's another one in there as well about consider the ethics. And one of the ones I wanted to pick up on is that there's some of these things that perhaps Wales could lead the way. I mean, there's a new centre for ethics, I think at UK level. Can't quite remember exactly what it's called, but data ethics. We've got to think about that as well. I mean, is this some, what are the challenges there for us? So perhaps it's the open data, then we're getting into the data ethics. If we train everybody up, we've got to consider how that works together. So I'm interested to see your thoughts on some of that. John?
I'm happy to come on that one, Simon. I mean, you're right. UK government have got an organisation called the Centre for Data Ethics and Innovation. We've got a very good relationship with them, and they want to work with us where we've got new and novel uses of data. I hate to say it's probably worth a session. It's a right, actually, data ethics. It's a huge topic. It's, just because it's legal doesn't mean you should, I suppose, is the strap line I would put there. I would say with it, so, if you're using data in a novel way, if you're using, I don't know, scans, there's something in the news recently about, using, I can't remember, is it bowel scans maybe to detect cancer? Actually, you can use artificial intelligence to help with that. But actually, you need to consider the ethics of it. And I think this is an area where we need to do more on, but actually it's awareness raising as much as anything. It's not reinventing the wheel. There's lots of good things out there already which people are doing. It's just guiding them to the right place to support what they need to do with it.
Okay. You've got a question that has come through here, and I suppose it very much, very rings true for what we're doing here at the centre on working with organisations to help them transform service delivery based on that user need and user understanding. So I suppose this is around the language. I think it's Simon Bush asked this. The language we're using, I think he's come from some work he's done with DEFRA, where the flood risk stuff, and where we then start presenting that data back to the citizens about, percentages and whatever. Did it really mean anything to them until we got into using descriptors such as low, moderate or severe? So it's that sort of thing. So it's how you take that user-centered design approach into that data, take the terminology about what users are actually looking and how they'd understand it. Are there any other things we've done across Wales that you can think of as case studies or examples where we've used the data, looked at the service design, and then actually made those changes based on that? Yeah, Jeremy?
Yeah, sort of two examples. When incident rates on the first wave increased quite high in Leicestershire. You remember Leicestershire and Manchester. The information was showing that the number of people coming through for tests there was quite low, and particularly in areas of high BAME communities, essentially. And so that information, there was loads of testing on the streets. We brought that into Wales well when it happened to us, and the biggest learning from that information was that actually you do need to change the language. One size fits all is good for the 80-20 rule, but actually we needed the support of local faith leaders, and we needed a different type of approach, even looking at the packaging and all of that feedback. But it started off with the data information, and language became, and different approaches became very, very important there, because just walking the streets with the military wasn't effective. So there's that example. And then the other example, I've mentioned it in the response, is that with Omicron and with everything else, you get your vaccine, it'll save your life, and it'll save your granny, and it'll save this. That's getting a little bit white noise now. What's it saving? We're going to be going to nightclubs soon as well. So we now need to turn it into more of a normal day practice. It's quite normal for you to go and get your flu jab if you're in this. And we got to get into social normal language, not it's very scary now, go and get your booster. We've got to make it part of every day. So language will have to be very different, and we've got to bring the research and evidence base into that, and actually where we want to target straight away. So those are sort of two examples I'd use recently, and we're going to be moving on. You're going to be seeing information from April and different types of language when it comes to elective care. So we've got a significant amount of people on the waiting list for elective care. We've projected that could be anywhere up to sort of 800,000, 900,000 people, in adults in Wales on a waiting list. Therefore, the language, the numbers are going to be really important, but the language we use about that in order to manage the expectations of delivery of that challenge is going to be really important as well. So that's it from an NHS perspective. I was thinking of three things.
Thank you very much. Conscious, I think we're right on the hour. I don't think we've got any more questions there or anything, so thank you very much. Thank you to everyone who's joined, and some of the questions have come through. I hope you've been inspired to go off and do more with data, to sign up to courses wherever they may be, and to make better use of data in everything we're doing. And so thank you very much. Thank you very much to all our speakers. Goodbye, everyone.
Thanks, everyone.
Thank you.
Take care.